Hello, everyone. It's July the 16th on Friday. We put our briefing off one day from yesterday. Regretfully, we have lost 10 folks from our last briefing on Tuesday. I don't think that this is alarming from the standpoint of that we should get, super concerned, but we absolutely want to be, without question, super respectful to these people, all their loved ones, all their families. But losing 10 people is a big deal. Losing one is a big deal. But we're up to 2,919 deaths now in West Virginia. Please don't forget these people. Don't let them become a number. Our 2,910th death in West Virginia is a 75-year-old male from Barber County. Our 2,911th death is a 68-year-old female from Raleigh County. Our 2,912th death is a 82-year-old female from Kanawha County. Our 2,913th death is a 63-year-old male from Kanawha County. Our 2,914th death is a 72-year-old female from Mercer County. Our 2,915th death is a 64-year-old male from Nicholas County. Our 2,916th death is an 80-year-old female from Jefferson County. Our 2,917th death is a 69-year-old male from Preston County. Our 2,918th death is an 86-year-old female from Barber County. And our 2,919th death in West Virginia is a 71-year-old male from Greenbrier County. Again, keep them close to your heart. Keep them in your prayers. If you happen to know any of these folks, please call them. Please at least call them. They don't need to feel alone in any way. We've had 90 new positive cases in the last 24 hours. We have a positivity rate of 2.71. We have a cumulative rate of 4.96. Our active cases have jumped up a little over 1,000 to 1,026. Our recovered cases are still, and I don't know that this number's not been updated in a while, but still a little over 160,000. We have 80 people that are hospitalized and 32 in the ICU units. We don't have any red counties. We have 1 orange county and 2 yellow counties now. 32 in our ICU units is scary. So we absolutely need to keep those people in our prayers as well as all these folks. If you're 65 years of age and older, absolutely whatever you do, if you get some kind of sniffle or whatever it may be, any kind of symptom at all, go get tested. Please go get tested. And we'll get you the antibodies and we'll get rid of this thing and get rid of it as quickly as possible. I was just looking while I was talking right here through this entire list of all these 10 folks that we lost. The youngest person was a 63-year-old male from Kanawha County. If you're 65 and above and you've got a symptom and you don't get a test, you're really, really making a bad move. As far as eligibility, it's 12 years old and older. It's really important you get your second shot. The effectiveness of these vaccines is off the chart good. They're safe and they're off the chart good. We need additional help from our young people, for getting our young people vaccinated. That help can come from parents and grandparents. All the information on the, on our COVID-19 vaccine info line is up there. I want to tell you again about the Delta variant. Everybody's kind of, talking about it. A lot of states and people there are scared to death about it. We still are not moving much on the Delta variant. We're up to 19 cases now. I think the last time we were here, we were at 18. It's moving really slowly in West Virginia, but mark it down, and the health officials can tell you over and over and over, this is coming. This is coming to West Virginia. The absolute vaccines are tremendously effective towards this variant. It's coming, and absolutely you need to be vaccinated. In our Do It for Baby Dog sweepstakes, we've got over 355,000 people that are registered. You know, we've had some tremendous winners and everything, and we gave out some incredible prizes on Wednesday. You know, I was fortunate enough to be able to go to Bell and walk out on a football field with a bunch of kids that were practicing there. I mean, I'm at home right there, no matter what anybody says. And absolutely an assistant coach that had been a volunteer coach there for many decades won one of our giant, big, beautiful trucks, and that was Thomas Sowers and everything that won that truck and everything. And we were really happy for him, and he's standing right beside me there. You know, Thomas is not a big statured guy, and that big truck and him just matched up perfect, to tell you the truth. But those kids, you talk about kids being jacked up, they were just that. They were so happy for him, it was unbelievable, and that's really good stuff. You know, then we went to Summersville, and a lady that worked in the healthcare industry and everything won a big truck right there and everything, and we were able to give that to her. Her name, Grace Fowler, and Grace, you know, we were really happy for her as well. You know, and then off we went to Bridgeport and really to Fairmont, I guess, and everything. And this gentleman, get this, his name, Tim Jackson, Timothy Jackson. And Tim and his family, I think Tim is a WVU graduate, I think, and then he moved to Washington State and just recently moved back here. He's working in the WVU robotics and all, you know, I mean, this is a brilliant guy, a wonderful young family in West Virginia that came home and absolutely made a heck of a choice in my book. So Baby Dog and I just handed him right there a check from all of us from West Virginia, Baby Dog's bone check and everything for $1 million. You know, and we can't lose sight about what this is all about, but this is just an incentive for just somebody that's his age right there. Last week we gave away a truck to a young man that's in, you know, the osteopathic school at Lewisburg, a young man that is on his way to becoming a doctor. We've got to get our young people vaccinated. And so tickled to death for Tim and Grace and Thomas. So way to go, guys, way to go. Or really, Tim, Grace, and Coach. You know, I couldn't be more happy. And so it was a great day. And now we've got a couple other things that we want to do right here online and everything. But Liam Cox from Weston won one of the 4-year full scholarships to any of our public institutions. And today is Liam's birthday. He's off somewhere enjoying his birthday, and we couldn't make it all work together where Liam could be with us, but we congratulate him. We've got you know, a backpack and a certificate and everything for Liam, and this is what it all looks like, Liam, if you'll get this online and everything, and your backpack and your scholarship and everything will be awaiting you after you celebrate this birthday, and we wish you a happy birthday today. Now, on the other hand, we've got a fellow with us. His name is Christopher Ellis, and Christopher is from Logan County in the town of Bruno. And Christopher is also a winner of a 4-year scholarship to any institution in our state that he chooses to go to, and absolutely everything paid, room, board, tuition, books, and on and on. So congratulations, Christopher, way to go. And I'm gonna read your thing, okay? Okay. And then we'll let you talk and take over, okay? All right. But this says, State of West Virginia, do it for Baby Dog. Save a life, change your life. Greetings, be it known that Christopher Ellis Bruno, West Virginia, is hereby awarded this full four-year scholarship to be used at any public institution in the great state of West Virginia. It's signed by me, Jim Justice, your governor, and it's also signed by the baby dog. And so, nevertheless, we're happy for you, Christopher, and please, you've got the stage now. Back as well.
Thank you very much.
Thank you very much.
Christopher, we're happy for you, and you're on your way in your life, and just go do great things. We know you're going to, and everything. And I love the fact, where you live, and I'm really proud of your county and proud of your area and everything. The people in southern West Virginia, the people all across this great state are unbelievable, but they're really special right there where you're at and everything. So congratulations to you and your whole family.
Thank you.
Okay, just real quick again, the 5th lottery drawing will be held next Wednesday, July the 21st. We have an additional weekly drawings that'll go on through August the 4th. You can still register if you've had your first vaccine shot. If you haven't and you don't have a vaccine shot yet, please go get your vaccine. Please go get your vaccine. There's all the ways to register and everything. It's so easy to register. We've got 355,000 plus registered. There should be a whole lot more registered because we've given over 1 million shots. So register and win these prizes and everything. And the grand prizes of $1,588,000 and a second place of $588,000 will be given out on the 4th of August, but we'll be giving out every week just what we've already been doing. A couple of giant trucks and $1 million and all these other prizes. So register, but you've got to get vaccinated. At the end of the day, we're continuing, just like General Hoyer said the other day, we haven't hit a wall and stopped. We're continuing to go up. It's slow, but we're going up. Now, just think about this just 1 second. If we continue to go up along that pathway, are we not saving lives? And we are. And those lives are worth, we can't calculate it. And so really and truly, just think about this. Right now in West Virginia, we've given first shots of 1,043,836 people. We are at a rate, and I want to make sure that I've got this exactly right, of the people that are older than 65 and older, we have them vaccinated at 88.7% right now. 88.7% of those folks are vaccinated. First shot. The people that are 50 and older, 81.5% of them are vaccinated. Now you just think, the lowest age, the youngest age I read today of the 10 folks that died was 63. These people, for the most part, are all safe. We just got to continue to get more and more of them vaccinated. For the folks that are 12 and older, remember we targeted 65. We wanted to get to 65 really badly. We're at 67% now. It keeps moving up. And there's absolutely, we want to try any and everything we can to continue to get our people vaccinated, because the more that are vaccinated, I've said it till I'm blue-green, but it is absolutely without question just this. The more that are vaccinated, the less will die. The more that are vaccinated, the less will die, for sure. Anybody in the world, no matter if they absolutely believe there's no way on the earth I'm going to ever get vaccinated, anybody would absolutely not challenge that statement. The more that are vaccinated, the less it'll die. And so in that, as long as we continue north, we're doing the right stuff. We're trying to get to 90% of the 65 and older and 85% of the 50 and older. As far as your free testing and everything, and it's special thanks to Walgreens and Fruth, we thank you beyond belief. And we tell everyone, continue to take advantage of the free testing. It can only save your life if you do have an issue. We have 2 outbreaks in our long-term care facilities. We're up to 4 outbreaks in our church community and everything in 3 counties. That's Cabell, McDowell, and Webster. We have 1 inmate with COVID today and 2 staff members. It's great work, and all the corrections people and all the healthcare people, great work. I encourage you again about giving blood and plasma. That's really important. You know, West Virginia's unemployment rate continues to drop. You know, West Virginia's seasonally adjusted unemployment rate dropped to 5.3% in June. We've still got folks that are out there that we need to get back to work. We've got signs up everywhere under the sun, where our businesses are pleading with people that that they have jobs available, good jobs, good paying jobs. Take advantage. Please take advantage. This is the 14th straight month that our rate has decreased. The number of unemployed state residents decreased by 1,700 this month. Now, if we got 1,700 more of our folks in West Virginia back in a month, that's good stuff. We just want to keep at it and keep at it and keep at it. We've still got 42,000 people in West Virginia that are not back to work or that are unemployed. The total employment, in the last period, and I may have this skewed somewhat and everything, but the number of unemployed state residents decreased by 1,700, and to a total of 42,000 in the state of West Virginia. So we still got a bunch of folks that we want to get back to work. The national unemployment rate increased by 0.1%, while ours continued to drop. So West Virginia, you continued to beat up on the nation and make yourselves look great, and that's really good. From a disaster assistance program, and those that were involved in the floods from February the 27th through March the 4th and everything, listen to me, please. We had severe storms and we had flooding. And you're encouraged, if you had any kind of damage, absolutely to review the many types of grants and or loans that are available from FEMA. The deadline is Monday to apply. So if you haven't gone on here and applied, you've got to get with it and apply by this coming Monday, July the 19th, if you've had damage. You can apply if you live in Cabell, Kanawha, Mingo, or Wayne counties. Information's up on that screen. You can apply if you live in Cabell, Kanawha, Mingo, and Wayne counties. Absolutely, if you've had damage, please go right on here and apply. And hopefully you'll be able to get assistance from FEMA and take care of that damage and move on down the road. Now, our new college website, the West Virginia HEPC Higher Ed, is expanding and revamping its online presence to make it easier for students and families to explore our state's wide range of financial aid and college planning programs. The HEPC just released College for West Virginia, which is a new and expanded resource for West Virginians to find information about our state's free resources for planning, applying, and paying for college. We want our kids in college, and absolutely there's all kinds of mechanisms and things that our folks are working really hard to make available to you. And so go online, look for collegeforwestvirginia.com, and absolutely review all the alternatives and everything of all the things that are available. So congratulations again to all the folks at HEPC, Sarah Tucker and everybody, way to go. Just keep up the great work that I know you do each and every day. Thank you so much. That's all I've got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar. Good afternoon. As the governor has pointed out, as we are looking around our country, we note that today every state in the country is reporting a rise in cases, new cases of COVID-19. In the last 2 weeks, we have doubled the number of cases in our country, and yesterday we had 35,500 new cases, which is the highest that we've seen now in several weeks. Hospitalizations in certain places are rising, and even though we haven't seen as many deaths proportionally as we have seen cases, we know that the number of deaths is a indicator that lags the number of cases. When we look at the Delta variant, which is, again, reminding people is a variant from India, where we see now that it's about 58% of the new cases in the US. And we know that for people that are hospitalized and people that are dying of COVID-19, that 98.5% or so of people hospitalized are unvaccinated, and over 99% of people dying are unvaccinated. So it's really, really important as we start to anticipate that the Delta variant will come to West Virginia and will become our most dominant form of COVID-19. Again, we've seen a 26% increase in the new cases over the last week. And we know that the reproductive value that we follow closely is starting to rise. And with that, it is almost certain that as we continue to assess the new cases and do the genetic sequencing, that we will start to find more and more of the Delta variant, which is the most dangerous for people that are not vaccinated. The Delta variant has a much, much higher ability to infect and to infect children, and in really hard-hit places of the country, like we see in Arkansas, that we see in Missouri, then the hospital beds are really starting to fill up very quickly, and they're filling up with people that are not vaccinated. So we've said this many, many times, and I will say it one more time, that we still have somewhat of an opportunity to protect our people from getting infected with COVID-19. Particularly the Delta variant that infects more easily, infects children, and can make people very sick that are unvaccinated. Being vaccinated is very, very protective and almost 100% protective against death from this really, really challenging new form of COVID-19. And so as we go forward West Virginia, it is really, really important that people listen right now, because once this virus gets here, then it's going to be too late for people that are not vaccinated to avoid what is now a preventable problem, a preventable infection, preventable severe disease, preventable hospitalizations, preventable deaths by vaccination. Thank you.
All right, thank you, Dr. Marsh. Dr. Anamjad, our state health officer, is also joining us today and is available for questions. Retired Major General Jim Hoyer and Secretary Bill Crouch had prior engagements today, and they will rejoin us next time. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thank you for taking my question. I appreciate it on this Friday. Good Friday to everybody. Either for Dr. Marsh or for the governor, it seems like, and while I applaud the efforts of consistency and due diligence and the tenacity that you're showing, while the needle is moving, it is not moving very quickly or with big swaths. Obviously, the message is not getting through to a vast number of people in the state. Up to 40% of those who live here, I know all those aren't eligible for the shot, but it still remains that a large number of people just aren't going to get it. At what point do you basically roll back or curtail your efforts to try to convince those people and come concentrate on the people who are vaccine agreeable and remind them the booster shots are coming, et cetera. The Delta variant, even though you're vaccinated, still presents a threat, as do the other variants and the original virus. You can still be infected even if you get vaccinated. Those types of things, because it seems like you're beating your head against the wall. So, gentlemen, I was just curious about your take on that. Thank you.
Well, Kenny, let me answer it because you know, Dr. Marsh is going to tell you from a medical side, I'm sure, that anybody that's not at least concerned about the variants that are out there, the Delta variant especially, you know, I met with a gentleman, you know, just in the near term or just last little while, you know, and he's all over the world, and he says, you know, in Europe, especially England, you know, right now, this you know, the variants that are and mostly Delta, but there's a lot of people really shook up there, and you know, he went on about it, but you know, I don't want to be an alarmist. I mean, we have been through, you know, what and back, and it's been really tough, and you know, wearing the mask and doing all the stuff, I get it, it's been really tough. But for us to not think that this is, or to sit back and think this is over, or sit back and think, you know, well, there's nothing we can do, you know, big mistake. I know it feels like I'm beating my head against the wall, and that's really the feeling, and you're accurate, Kenny, in that. But without any question, every single shot that goes in an arm is a success. Now, we can't make people and bring them all to the table, but Kenny, they'll come running out of the woodwork in every direction if we have a lot of people start dying. There's no consequence that I want, none at all. I'd rather beat my head against the wall and take our successes that we get, and everybody continue to try just as hard as we possibly can, rather than just walk away and then awaken to a situation to where everybody calls and they say, Governor, what's going on? Governor, do you realize this is running all over the land? Governor, what are we going to do? What are we going to do? And Kenny, just step back and think. It's the middle of July right now. In probably less than a month, we'll be going back to school. In a little over a month, there'll be 60,000 people in our football stadiums and everything, and I love it, because we'll be headed back to normalcy. In all of that, if you don't believe that we should continue to stay the course and try with all in us, you're not thinking right. We need to absolutely continue to get every single person vaccinated we can. It's tough, and believe me, it's time consuming and it's hard. And in a lot of ways, if you're me and you're really honest, you feel like saying, listen, if you don't want to get the vaccine, then don't call me with the problem. But that isn't how it works, is it? You know, I want to try to help every West Virginian I can possibly help, and I'm going to stay the course. I'm going to stay the course and try everything I can possibly do.
All right, thanks, Kenny. Next, we'll go to Veronica Obey with WDTV.
Thank you. Good afternoon, everyone. Still kind of staying the course of the Delta variant. Today, Los Angeles County announced that they will be bringing in their mask order starting on Saturday, obviously on the West Coast, and they're a little more populated than we are. Is this something, you know, as we're waiting for this wave to come about, that we could consider bringing masks back, or any suggestions to maybe business owners, et cetera? I'd love to hear the governor and a little bit from Dr. Clay Marsh. Thank you.
Well, the net of the whole thing is, first and foremost, we're not Los Angeles. Thank God, you know, and boy, do I ever mean that, you know, but on top of that, we got to watch, don't we? From the standpoint of bringing back the mask or whatever like that, again, I pray to God above that we never have to consider such a thing ever again. But we've always got to watch. And Dr. Marsh, I think you can probably take it from there, but surely we sure don't want mandates on our businesses, but we always got to watch. Okay, Doc.
Thank you, Governor, and thank you, Veronica. You know, it's important that each person make sure that you're taking care of your own health and safety as well as that of your family. So I think as opposed to waiting for more global mandates to come back, which that's really the governor's decision for the state, but it's really important that we take care of any of our family members, including children that are less than 12 years old, and anybody who's vulnerable and anybody that's not vaccinated fully, with wearing masks and staying physically distanced, trying to stay outside versus inside, washing your hands, just like we did before all the vaccines became available. Because we do know that this Delta variant that has affected Los Angeles and many other places has a much, much higher tendency to spread and infect anybody, children just like adults. And so by protecting ourselves and protecting our families, we then protect other people. So I'd say for the folks in West Virginia, that if you're going into environments where you feel at risk or you don't know everybody, big crowds, then wearing a mask is a very reasonable decision, staying distanced as much as you can, washing your hands, and just being careful.
All right, thanks, Veronica. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I was wondering if the state had any other plans for vaccine incentive programs beyond the conclusion of the lottery. You know, as we've already kind of discussed on here, it seems like offering $1 million hasn't served as that much of an incentive, so I don't know what else would be left on the table. But are there any other options or strategies we're thinking about trying after the lottery is done on the 4th? Thank you.
Charles, right now we've not gone any further than where we're at, and along the way, you know, we had to do a lot of things, you know, and we had to set certain dates and stop things and go things and everything on certain dates, but right now we don't have any other plans. So I would highly incentivize anyone to go get vaccinated now, get in these drawings. You know, I think we're going to, you know, at least we're going to hope and pray that we continue on the pathway and get our vaccination numbers where we've maybe exhausted a lot of efforts and everything. And as we continue to try to find any other ways, we'll come to you with those ways. But right now, we're looking at wrapping the incentives up on August the 4th, unless we can come up with another marketing plan.
All right, thank you, Charles. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, Dr. Marsh and Dr. Amjad. I have a couple of friends who were fully vaccinated with Pfizer that have now come down with COVID-19, and I want to ask a question about testing. Should the alarm bell to get tested be the same as it was before you got the vaccine? If you get those sniffles that the governor refers to or whatever, is there a false sense of security once you've gotten a shot that nothing could ever happen to you? Governor, doctors?
Well, Paul, I'm going to pass to the docs on this, and Dr. Amjad and Dr. Marsh can answer this better than I, but the one thing, Paul, that's really good, we know that nothing can be 100%. Nothing in life. But the chances of you getting COVID are really greatly reduced. But the great thing about it is, for the folks that do get it, that have been vaccinated, the hospitalization, numbers are greatly reduced, and the death is almost zero. But anyway, I'll turn it over to Dr. Amjad and Dr. Marsh on that.
Yes, Paul. So, I mean, the governor's correct. So your hospitalization and death does reduce with the vaccine, but to go along with what you're asking, definitely you do want to get tested for COVID-19 if you have the sniffles or any risk factors. So we would recommend that even though you're vaccinated, to go ahead and get tested. The benefits of the vaccine are reduced hospitalizations, as mentioned, but you do want to go ahead and get tested, because if you do have COVID-19, while you don't have to quarantine, as the benefits of the vaccine does make that, you might want to at least not go around children or someone that's highly susceptible that can get sick, or also someone that's not been vaccinated. So we do recommend to get tested for COVID-19 if you have the sniffles or you're sick or if you've been traveling or anything like that. But I don't know if Clay has anything to add for that.
The only other thing I would say, and thank you, Ayn, and Governor and Paul, is that so far in West Virginia, I believe that we have reported 883 breakthrough cases out of 866,350 fully vaccinated West Virginians. So the vaccine in West Virginia right now is felt to be 99.9% effective in preventing breakthrough infections. And again, breakthrough infections are where you've been completely vaccinated, you're 2 weeks after that vaccine, and you're well, and then you get infected after that. We are seeing very few of those, but certainly anytime you develop any symptoms, vaccinated or not, we have free testing, and COVID with the Delta variant coming is more infectious. So absolutely, I would agree 100% you should absolutely get vaccinated, or I'm sorry, get tested.
All right, thank you, Paul. Next to Mark Curtis with Nexstar Media.
Good afternoon, everyone. As you can probably tell, I'm driving, but I have both hands on the wheel, and I'm looking straight ahead. One of my coworkers holding up the cell phone. We're coming from Rod Jackson's memorial service, our late news director, who had a tribute in Huntington today. And I just want to let you know, Governor, the tribute video, it included your video sound bites where you talked about Rod at the briefing a couple weeks ago. And again, we want to thank you for that, Senators Manchin and Kappa as well. So again, thank you for your kind words. On to my question now. Governor, you mentioned school opening up in a month. What are the plans to hold clinics in all middle schools and high schools around the state? You're talking about the young people and how difficult it is to get the shots in the arms, especially in the young, who are the most vulnerable now to the Delta variants and the others. What are your plans, if any, to have clinics in the middle and high schools across the state?
Mark, we're having a little trouble hearing you and everything, and I'm having a lot of trouble hearing you, but as far as the plans, the up and coming plans for the high school and the clinics and schools, you know, as we come back to school and everything, you know, we'll continue making it available, you know, as far as giving the shots. There's a lot of work still to be refined with the, you know, with Clayton Birch and the Board of Education, or the education folks and everything within along with our medical experts, but you know, there's no certain plans other than you know, that we have thus far, but we'll continue to work on that.
All right, thanks, Mark. Governor, I'll turn it back to you.
Oh well, okay, Jordan. I want to show this right here, and maybe you could zoom in on this and everything, but I just, you know, our people took this picture of Thomas Sowers and everything, the coach at Riverside. And this is his young kids that he works with all the time. You know, Thomas is a volunteer assistant, and he's done so, like I said, for decades. I wrote on this picture and everything, because I'm sending this to him, I said, Coach, congrats on the truck, but more so, congrats on exactly what this picture is saying. This picture is saying absolutely the great work you've done with kids, and it is echoing all over it that these kids love this man and love this coach. So absolutely, Thomas, way to go. I couldn't be more proud to sign the picture and everything, but what I'm more proud of than anything is just one thing, and that is this great work you're doing with these kids. Way to go, Thomas. That's great work. And beyond that, I don't have anything other than to say, you know, that we're going to continue the course, and we're going to all keep working. We're going to keep pulling the rope. I thank the broadcasters again and again, and you know, for all those that you know, all the help that they've done and stepped up and trying to get more and more folks vaccinated. And just look, I mean, the proof's in the pudding. That's all there is to it. Almost 80, we're on the way to 90% of those that are over 65 and older. And we're on the way to 85% of those that are 50 and older. And we were on the way to 65%, but now we're at 67 of the 12 and older. Absolutely, West Virginia. You've done great. Don't let anybody tell you haven't done great. It hadn't been easy. And we're all working hard, and I thank all the broadcasters. I thank all of you in every way. You know, we're going to keep at it. We're winning this battle. In some way, somehow, we're going to get across the finish line where we don't have to sit here and read any deaths. But nevertheless, keep these people in your thoughts and prayers. The sun's shining and the weekend's coming, but for these people, it's tough stuff. For 10 people in West Virginia, it's tough stuff. For 2,919 people, it's tough stuff. Remember them. They're great people. We've lost them. We're going to go north, and we're going to continue to go forward. And bless you. Bless you. All right. Thank y'all so much.